Hello and welcome to another chat of hot flashes and cool chats. Just so everyone knows, I started these conversations because through my work in the community that I'm building, I am meeting so many amazing people who are passionate about supporting women in midlife, just like me. And I was thinking, I cannot just be meeting these people and it stopped there. I need to share it. So, this chat series is really my way of introducing all these amazing people that I'm meeting to you so you can hear the stories, that you can get to know them personally. You can learn about their products, their services, maybe what kind of resources they might be for you or a family member. And especially in this season of us women where we are in so much chaos, this might make our life a little bit brighter, a little bit easier, and help us get empowered a little bit more. So, with that, today I've got a really great guest, Dr. Neal Patel. So, you and I have worked together on a couple different projects, and I'm so excited because I love that work that you're doing. You are the founder of Phantom Medical. And you're a physician, but you're an innovator and you're so creative. And the way that you're changing the way that we're thinking about healthcare is exciting. And I want to make sure that other people know who you are and what you do and how you support women in midlife. So, hello and welcome.
Hi, Meredith. Thank you so much for having me. It's great seeing you. And yeah, we've known each other now at least over a year, 2 years, and been working on a few projects. So it's great to see you here. And yeah, so as you mentioned, I'm the founder of Phantom Medical. It's my medical corporation. I am a doctor currently in private practice in the city of Orange, in Orange County, California, of course. And for me, my personal philosophy in medicine has always been less pills, less surgeries, less doctors, less procedures, the better. There's a lot of power
Yes.
within yourself and others, especially women. Obviously, if you need some things, I'm not opposed to it, but I like to use those tools as plan B, not plan A. I
Yeah.
usually see mainly adults. My focus is on geriatrics for the most part, and that, of course, includes women going through their journey per se, including
Yeah.
postmenopause, menopause, premenopause.
Yes.
Yeah.
Yeah, I love it. I love it. And I feel like that's exactly it. I think we talk about this often where we have a sick care system and we don't really have this healthcare system. So, I think so many of us are obviously we need, Western medicine. Of course, there's a need for it, but there's something about Eastern medicine that really is speaking to a lot of us because we want to be preventative. We've got so much stuff that's going on in our bodies where almost at a loss. We're confused. When we go to our doctor, we're almost referred everywhere and we're referred medication. So we need to take a breath and we need to learn from you. We want to understand how come you're doing things differently. Help us learn more about what you do and maybe your philosophy.
Yeah, absolutely. In terms of, especially for women's health, it's not a simple road. I get asked all the time, I'm having hot flashes. When is it over? I said, I don't know. Enjoy the ride or don't enjoy the ride. Good luck, because
Yeah,
every woman has an individual journey. And so my
yeah,
goal is to try to guide them through their journey. And some women get lucky, they have no symptoms, some have a lot. Of course, there's a lot of medicines that have been used for a while in terms of like contraceptives, not contraceptives, hormone replacements, right? Those are very
hmm,
common, but there's so many
yeah,
other supplements at this time. I'm very big on outside the box, as you mentioned, and not saying I'm anti-supplements, but I don't want my patients to substitute pills for 20 supplements either. So
yeah,
usually in terms of for women going through their journey, for example, we always start with what can we control right now? And that
yeah,
usually includes, of course, simple things. The four pillars of good health for me personally: diet, exercise, stress, and sleep.
mm,
Obviously, these will shift when a woman is going through her journey per se. But number one is diet. So I always ask my patients, what are you eating? And that
yeah,
can affect people or women specifically in a lot of different ways. So inflammatory diets, right? The sad diet I learned recently is I think American diet is what they call it. So it's not the best. So it's all the fast food, all of the processed foods, all of the maybe alcohol we drink, that can definitely play a big role on our hormonal systems, especially for women.
Yeah, I feel like on the talks and the times that the presentations you've done, as well as the personal talks you and I have had, food is medicine really is. I hear it from you, and I love that you say that because it's so true. I think we're in the system that it's so easy to, like you're saying, grab a supplement or grab a bar or grab fast food, and we need to be grabbing the right things and then we won't need to be grabbing the artificial things. So I don't know. Do you have any advice for us women in general? It doesn't have to be women, I guess, but in general, but maybe for us women in
Yeah,
midlife suffering from some of this.
absolutely. No one wants to hear it, though. I'll be honest. Most of my women patients don't want to hear it, but that includes no alcohol. Not here to
Oy.
take away your fun, but trust me, yeah, I hear that all the time. Or you can bring the alcohol to our office. We'll take it from you. And usually, alcohol will affect your hormonal system quite a bit, especially when
Mm,
women complain of hot flashes. Alcohol itself can cause you to sweat. That's one. And it's not also what you're eating. Of course, there's different types of diets, inflammatory. It's how you eat and when you eat. So if
mm,
you're going through cravings, for example, some women might be like, hey, I had dinner. Now I'm craving something. Let me eat something late at night. That can
mm,
also throw you off your system. Or if you eat big portions. So those type of things also play a role. Water.
mm,
Weird stuff. Simple things are still simple for a reason. So drinking water, staying hydrated can also kind of help them go through this journey. And then, of course, like I said, I'm not opposed to the supplements. There are certain brands or certain types maybe that are pretty good. Metagenics is one. But overall, my goal is not to add things to a patient's life, is to subtract things. How to simplify and really give you the power in your hands right now when you leave my office.
yeah, yeah, I love that. It's interesting that you do say that about alcohol, and I jokingly plugged my ears, but the truth of the matter is that I don't even metabolize it the same as I used to.
Mhm.
So I don't even enjoy it as much. It's not to say I've completely given it up. Let's be honest, I have not. But the truth is, I don't even like the way it makes me feel anymore. And I know there's something scientific too going on where my body just cannot process it the same. Am
Yeah,
I right?
absolutely. Yeah, absolutely.
Mm,
Alcohol, of course, there's new studies show no alcohol is good for you. And
mm,
obviously nobody wants to hear that either, especially
mm.
with wine and oh, wine has resveratrol and it's good and one glass. Depends on how big is your glass. That's also part of it.
So that
So
that myth of the red wine is no longer valid anymore.
technically, no. All studies have shown now that no amount of alcohol is healthy, but
Mm,
like, that's hard on the ears usually. So
yeah,
usually I tell patients, it's not about cutting things out cold turkey or being black and white, because that's for me, it's not only about making the changes, it's what's realistic and sustainable. I can tell
yeah,
you, my patients, quit alcohol, eat rice cakes all day. Is that realistic? Not really. What is gonna stick and work for your lifestyle and your habits? So I'm
yeah,
all about plus one, minus one. Instead of
yeah.
two drinks, one drink. Instead of two cookies, one cookie. Instead of
Mm,
one, maybe 10 minutes of exercise, 11 minutes of exercise, right? So plus one, minus one. So you start to slowly build the right habits because that is more important. I tell patients, don't chase numbers, chase the lifestyle.
yeah, I love that.
Mhm.
You had mentioned you had a couple pillars. So we've got, you said food was probably number one.
Mhm.
What would you think would be number two? Is that sleep,
Uh,
stress,
exercise.
exercise? Mm,
Absolutely across the board, especially right when women are going through their journey with menopause, perimenopause, as you know, they are at higher risk for osteoporosis, bone pain, bone issues.
mm.
So it's
Joint.
very important. Yeah, and for me, I see a lot of seniors, and for me, independence is key to your quality of life, and that includes obviously your mobility. And so for my patients, especially women, actually, honestly, anybody, I tell you, if your body works, you better use it. That's one. And
Yeah.
walking doesn't always count. Okay. I got patients who walk for like 1 mile a day, 3 times a week. But I
Oh,
said, what about the rest of your body? Our bodies are incredible systems full of muscles, full of life. You want to
Yeah.
strain and put some stress. So strength training, resistance training can
Mm.
actually strengthen your bones probably more than any pill, any supplement on the market.
Wow. Yeah, and probably different movements, right? We have to be in different planes. So we're
Mhm.
not just walking and all of a sudden everything else gets stuck in one plane, I would assume, right?
Exactly. Your body's full of different, motions. So if you walk on
Yeah.
a treadmill, I mean, at this point, honestly, I've come to the point where I have to tell patients, just stand. That's how the reality has become because we become that type of culture. If you're
Yeah.
able to move, you want to do different types of activities, different speeds, right? And then, of course, like I said, even I try to be same, meet my patients where they're at. So if they're just gonna walk, I say, you know what? If this works for you, don't change the walking, add or wrist weights or ankle weights, or add like a
Mm.
little backpack to add weights to you as you walk.
Got
So that
it.
way we can accommodate.
Kind of give it a little bit more resistance or like you said, stress or strain to the body to not just get stuck in a certain habit, I would assume, right? And keep
Yeah.
working hard.
And
Yeah.
especially like I tell like I say patients say, for example, oh, I walk 3 times a week. Okay, so what about the other 4 days? I said, no. I tell them I only want you to brush your teeth the days you exercise. Like, would they
Oh,
ever
I
do that?
love
I said,
that.
that's crazy. Like, well, exercise is medicine. Why do you brush your teeth? Just wait for your teeth to fall out. There's
Oh
a
my
reason
gosh.
to exercise. It is prevention. It is the number one thing studied across the board for like physical, mental, emotional, spiritual well-being.
I love that perspective too. And it's almost like it puts it in perspective for the client or the patient.
Mhm.
Oh my gosh, I didn't even think of it that way. Why would I not brush my teeth every day? Of course, why would I not exercise every day? I love that. I love
Right.
that creativity. See, this is your outside the box stuff. So why don't we keep working on your pillars? So then what would you say would be
Yeah.
the third, I guess, most
Yeah,
important? I know
stress.
they're all important,
They
but
are
yeah.
important. I mean, for me personally, I think nothing is 100%. So if you got 4 pillars, if you're good, 3 out of 4, so hitting over 75%. Sleep is very important, but stress is huge. And stress
Yeah.
is, oh, well, I just gave a presentation recently about stress and how I said, well, everybody's stressed. That's normal. So when have we come to a point in society where stress is the normal way of living? It's kind of
Yeah.
bizarre, actually, where if you're not stressed, it's almost your body's not used to it. So
Yeah.
it's becoming unhealthy to be calm. It should never be the case, but stress is very powerful. And I do believe that stress, if you or whoever the patient does not get it out, it will find its way out in bad
Mm.
ways, right? That's why even like I truly believe, even like sometimes blood pressure, cholesterol, cancers are your body screaming at you, saying, hey, you're not listening to me all these years. Hey, you've ignored this. I have no choice but to scream now. And then, of
Wow.
course, with those types of diagnoses, it causes more stress. You see, then you get
Mm.
just perpetual motion.
Yeah,
So,
it's
yeah.
interesting you said that too, because I spoke to a friend of mine just the other day, Julie, she's on one of the chats. She had breast cancer and she literally said the same thing. I wasn't listening and my body had to scream at me.
Yes,
Yeah.
yeah. So,
Yeah.
so for women specifically, there's a book. I don't know if you've heard about Louise Hay. I think it's
Mm.
How to Heal Your Life. She's an older, motivational, inspirational speaker. She's passed now, but she's all about like loving yourself. And she actually had her own. She was like had a crazy upbringing, trauma and abandoned, all these things. She went through breast cancer and they told her, you got to do chemo, radiation. She said, no, there's something I got to fix in my body. So she started
Yeah.
loving herself. She really did all the alternatives. She was cancer free without medication, which is quite phenomenal. So that's what I
Yeah.
mean. The power is within us. It's just how do we channel it instead of going right to the medicine? Because that is
Yeah.
also advertised. We're the only country in the world besides New Zealand that can advertise medicine directly to consumers. No other country
Mm.
can do it.
That's interesting. I don't think many of us know that. And it's,
Yeah.
I mean, we see it all. I mean, you can't even watch a show without everything being medication and then obviously them like a auctioneer telling us everything that's going to happen to us. So
Yeah,
yeah, I'm not a big taker of medicine if I don't have to. So
exactly.
I like that. Kind of on that topic of stress too, obviously with women in midlife. We kind of have some natural stress. I think for all of us, there might be a variety of things. Number one, our body, what's going on. Sometimes some of us are having, career shifts or, because it's shifted for us or because we're realizing what we are doing is not aligned with us anymore. But we also are being pulled, right? The sandwich generation. We've got mom and dad aging and everything that comes with that, whether you're physically helping them or mentally worried or whatever it might be. And on the other side, you've got your growing kids that you might be still shuttling and chauffeuring, but then maybe are off and driving, which is scary in itself, or moving out and all the stress that comes with that. So any advice, I guess, I don't know if it's easy to ask for that, but any advice for us women in midlife for stress, what's something we should do?
Yeah, absolutely. I mean, look, life is life, all right? Life is not a simple road. Life is not meant to be easy. You're gonna have a lot of external stressors, right? The more people involved, the more emotions involved, whatever you name it, financial, physical, emotional. It's part of the experience of being a human, men and
Yeah.
women. But for women, of course, they go through more ups and downs per se, even with pregnancy, menopause, you name it. Um,
Yeah.
I usually say everybody has their responsibilities. I understand that. Don't forget yourself because, like I said, I'm very big on education. I educate with Alzheimer's Orange County and I give talks on how to take care of the caregivers. So, because caregivers also burn out. But in general, for women or anybody, like if you got kids, for example, you put them on timeout. All right, go to your room, put yourself on timeout. 5 minutes timeout. You sit down and do nothing. Because the hardest thing
Nice.
to do as a human is nothing. I tell my patients, stare at a wall for 5 minutes. No phone,
Yeah.
no music, no distraction, don't talk to anybody. Stare at a wall for 5 minutes and see if you can do it.
Wow. That's a
Yes.
really good tip. And it's so easy, right? It's the simple stuff. And like you're saying, add one plus, add one minus one. 1 minute, try it for 1 minute, then try it for five. I know for me personally, I have added meditation into my life over the last handful
Right.
of years, quite a bit. And I don't do 30 minutes, I do five. And
Hmm.
sometimes I'll put on a 5 minute and I get 2 minutes into it and my brain is racing or whatever. So I stretch for the other three. But I give myself this time. So I love that. All right,
Hmm.
so we're going to get to our last pillar, which is sleep.
Yes. So that
Yeah.
is tricky because that changes as we age. That changes with menopause as well. So that is very tricky. I sleep, honestly, when it comes to that, we kind of try. That's when we come into supplements sometimes. There are actually scented lavender oils or candles have been shown for women with menopause or premenopause scientifically to help with sleep. So that
Mm-hmm.
is a purely natural, not a pill thing you can try like tonight. If you got a lavender candle, light it. So that can
Oh,
help. Realistically, you think about as a child, right? You train them, timeout. Put yourself on timeout. You put them to sleep at a certain time. You put yourself to sleep at a certain time. Of course, with technology, everybody's sleeping not with a teddy bear, but their iPhone now as their teddy bear.
yeah.
So the goal is no screen time if you're able to. Like I personally, no screen time about 20 to 30 minutes before I sleep. Put it
Mm,
away, do not disturb mode, all of that. Obviously, as we mentioned, people have their own lives. They might have stress, meetings, emails, text. So I would say the best thing to do is time out from your phone, number one, and then sleep hygiene is big. So that includes keeping your room cool, dark.
mm,
The lavender is a great way. Some people meditate at night to clear the brain, so that's also an
mm.
option. I don't personally stretch a lot. I need to, but stretching I've heard is very therapeutic. And then, of
Mm.
course, there's supplements for everything, including sleep.
Yeah.
Yeah,
Yeah. Tea. I do tea at night, chamomile
yeah,
herbal type stuff.
absolutely.
Yeah.
Green tea, chamomile tea is a great one that can help calm.
Hmm.
That's shown some studies that can help. So, yeah, only issue some women might have bladder issues, so they might pee more. So that's the
Ooh,
only sometimes. But if when I tell for sleep, if it works for you, just do it outside of
yeah.
certain things.
Yeah. That's when our brain is restoring itself. We're getting all the healing that we need. So it is so important. And
Mhm.
it's so hard because with the hormones, luckily for me, I sleep like a baby, so I'm very lucky. But yeah, I mean, there were times where you're up in the middle of the night, and sometimes it's just because your body's triggering, and you talk to your spouse, and they're like, I don't have anything on my mind. I just randomly woke up. But then there's other times stress
Yeah.
and affects the sleep because you wake up with all the worries in your world. Somebody had told me, I was talking to somebody recently that was saying before you go to bed is kind of when you talk to your body and ask it for answers.
Hmm.
Because while you're sleeping, and actually some of the things will come to you when you wake up. So I thought that was so interesting. I got to start doing that.
Absolutely. I think the Dalai Lama says sleep is the best meditation. Right. So
Mm.
even for me personally now, I used to be a little more impulsive with decision making, but let's say I have to make a big decision. I say, you know what? Let me sleep on it. That's it.
Uh-huh.
I never rush to any decision because really, what's the rush in life? So I
Yeah.
say, let me sleep on it because that can help clear. I personally journal. So for women or anybody who's, like I said, maybe has time out for 5 minutes, get it out of your body. A lot of people are not only physically constipated now, they're mentally constipated.
Yeah.
They got to get it
And
out.
this digital world, honestly, it's so challenging because everybody has a platform.
Hmm.
So, whether you go to your doctor or school or work, everyone's platform. You have to know everything in this big maze of information. It's overwhelming, but
Yeah.
yeah, yeah, I get it. I love it because honestly, this has been such a great conversation. You just have such a great foundation on these pillars and how you lead and you support and you I guess approach medicine in a way. And that's just one thing that I really respect and appreciate. And you're such an easy person and relatable. You're not talking above people's heads. I think that's a hard part with women sometimes, sure with men too. Is you go to the doctor and all of a sudden you understand like a third of what they even said. So
Right.
I love your approach so much. But I wanted to find out before we wrap up here, what is the best way for people to get a hold of you? Because you're such a wealth of knowledge and people need this is just the tip of the iceberg to get to know you. So how can people find you and get a hold of you?
Yeah. So as you kind of mentioned, social media obviously is overwhelming information, and I'm gonna overwhelm people now as well on social media. So I've actually started social media. So my is it called handle? I think I'm still learning all the terms. Handle is at Dr. Neal H. Patel. So I'm on Instagram, TikTok. No dancing though. You can't dance your way out of menopause either. So, but you should exercise.
Yes.
So that's one way. And then I do have my office information for those who are interested in either calling if they want to be my patient. I am taking new patients. I am in the city of Orange, and we can, my office number is, I can just give it to you in like the link, and that way you
Yep.
can put that. But yeah, I'm open.
Yep.
I'd love to help my patients. My biggest message is please have you help yourself. So anybody watching this, help yourself because the truth
Yeah.
is the medical system, we're probably going to implode at some point, and
Hmm.
I want people to take ownership. We are a team. And
Yeah.
so I only have two types of patients, those that I help and those that help themselves.
I love that. And it is so true. I feel like you have to be an advocate for yourself.
Yes.
The way that our system is now, educate, learn, and find really good resources like you. So I really appreciate it. I want to thank you for coming on. I think you are our first male
All
on Hot
right.
Flashes and Cool Chats. So you know what? See how cool you are?
All right. I love it.
Yeah,
Great.
yeah. Thank you.
Well,
But
thank you
thank
so
you
much.
so
Yeah.
much. I really appreciate your time, your expertise, your wisdom. And of course, we'll put all your links and everything, in the show notes. But until next time, mamas, remember you're not alone. You're on this journey together, whether you're with a male or a female, whoever you are. If you want resources that are male or female, we are here for you. So you're not alone, like I said, on this midlife journey. And here's to more hot flashes, cool chats, and of course, meaningful conversations like with Dr. Patel. So thank you so, so much.
Great. Thank you so much, Meredith.
All right. See you guys soon.